Welcome back to Y News. The government is preparing for the COVID-19 endemic stage in the Philippines. However, the health department emphasized that endemic stage doesn't mean a milder form of the disease. Aiko Miguel will tell us why.
Acting Presidential Spokesperson and Cabinet Secretary Carlo Nograles said that the government is currently formulating the National Action Plan Phase 5. This would include protocol and policy shifts on the country's COVID-19 response. However, CABSEC Nograles said alert level and existing safety and health protocols against COVID-19 will stay. He also said that it is too early that we have won over the virus, as some provinces are just starting to have a high vaccination rate.
Maaga pa rin para magdeklara ng lubos na tagumpay kontra COVID-19. Ito rin ang tinuran ng World Health Organization noong Martes, February 1, 2022, when it said, and I quote, "It is premature for any country to declare victory." End of quote.
Health spokesperson Undersecretary Maria Rosario Vergere also said the government cannot declare that pandemic is over in the country in the near future.
Mahirap po mag-declare ng end of pandemic na Pilipinas lang because as the pandemic's definition would be, it crosses borders, no? It includes other countries and territories. So mahirap na Pilipinas. Ang Pilipinas, ang bansa natin, can always declare yung success natin sa mga strategiya nating ginawa. But having to declare na end na ng pandemic sa Pilipinas lang would be impossible. No? It's out of definition.
Undersecretary Vergere also said authorities are now also focused on preparing everyone to cope with the transition that COVID-19 become endemic in the Philippines.
Pine-prepare na po natin yung ating sistema para pagdating po nung point na talagang ang state is endemic na, and then we will be able to cope and we are resilient and we are prepared.
However, the health officials said the public should understand what an endemic stage really is.
I think a lot of people are getting a wrong perception of what an endemic state is. This is a state wherein cases are stable, cases are already constant and predictable, but it doesn't mean na pag sinabi natin ganon, it's going to give you a milder form of the disease. There is that level na balance na, or there is that equilibrium between the level of transmission and the level of immunity in an area.
Undersecretary Vergere also gave an example that some infectious diseases in the country are also in an endemic stage.
Best example, yung atin pong sakit na tigdas. Ang sakit na tigdas po, endemic yan sa Pilipinas. Ngayon po, tayo ay meron po tayong bakunahan sa tigdas sa ating mga kabataan. Dumadating tayo sa punto that we reach that certain level na mataas talaga na halos walang nagkakatigdas. Pero alam natin, nagsa-cyclical po ang pag-outbreak ng tigdas sa Pilipinas kapag bumababa ang immunity ng population. Ibig sabihin na dadagdagan yung susceptible na mga walang bakuna. So ganun po ang endemicity.
The government assures that there may be possible COVID-19 variants to exist, but at least the government has coped with proper hospital care and management of those infected with COVID-19. The government has also strengthened prevention and mitigation of COVID-19 outbreaks compared to the early year of the COVID-19 pandemic. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Iloilo City is still considered very high risk for COVID-19, according to a member of the Octa Research Group. Lalaine Moreno reports why.
Independent Octa Research Group reported on Friday that Iloilo City remained under very high risk for COVID-19. Octa fellow Guido David said the average daily attack rate in the city is 60.45%, while the healthcare utilization reached 71%. But according to the data of the city government, it only reached 68% of its healthcare utilization.
Ang aton nga healthcare utilization rate sa kahapon 66% or 68% diri sa aton sa syudad. Amo niyang data ang data yung kapot kita ang nagahalin ang mga data naton sa aton diri sa local government kag sa DOH naton.
DOH-6 also confirmed this data, stating they have their basis and that OCTA is only an independent research group. Meanwhile, high cases in the city were caused by local transmission due to the Omicron variant, in which 17 Omicron cases were recorded by DOH. As of February 3, Iloilo City had 64 occupied ICU beds and 263 isolation beds. Iloilo City has now 3,127 active cases. Harlene Moreno, UNTV News and Rescue. We serve the people. We give glory to God.
The Philippines recorded 8,564 new cases of the novel coronavirus disease, or COVID-19, pushing the nationwide case count to 3,594,002. This was the fourth consecutive day that the single-day tally stayed below 10,000. Active cases nationwide stood at 151,389. Majority or 139,940 have mild symptoms. 6,522 are in moderate condition. 1,500 are severe, and 320 are critical. Meanwhile, 10,474 new survivors were logged. This brought the recovery tally to 3,388,399. The death toll have, however, climbed to 54,214 after 46 more patients died. Meanwhile, the overall global COVID-19 caseload has topped 388,202,063, while deaths have surged to 5,713,601, according to the Johns Hopkins University. The U.S. is the worst-hit country with the world's highest number of cases and deaths at 75,994,966 and 897,377 respectively. This is followed by India and Brazil.
The 2020-2021 digital examination finally commenced in over 30 testing centers across the country today. The first digitalized and localized test had a 96.5% turnout. The Supreme Court expects the bar exam results to be released earlier than usual. Asher Kadapan Jr. will tell us why live. Yes, Asher, good evening. Go ahead.
Good evening, William. The 2020-2021 bar examination being conducted in all 31 testing sites across the country are being held in digital modality. This means that almost all examinees are bringing their laptop except for 12 individuals who requested to use handwriting and a person with incapability who opt to use a stenographer. This is the first time that Supreme Court is using the digital format in the bar exams. Consequently, Justice Marvic Leonin says the result of the exam may probably be made available earlier than the usual 5-month waiting period.
Usually, it comes out sometime May kapag November yung bar. Okay, so that will be about 5 or 6 months. Okay, since we are doing it in a digital modality, there is a possibility, a very high possibility na mas madali yung exam, mas madali yung checking. Sorry, hindi mas madali. Mas madali yung checking kasi magiging hindi naman online, pero magiging computerized yung checking ng mga examiners.
Justice Leonin, however, assured that the software that will be used in the personal laptops of the examinees will restrict any other functions in their equipment.
The software that we have procured will stop all existing apps, including the operating system. And therefore, as soon as they enter the password for the examination questions that they downloaded early this morning, no app will be allowed by their computer. They cannot even use screenshot. They can not even use any peripheral device connected to their laptop, except, of course, their power adapters.
Based on the data gathered by the Supreme Court, out of the 11,790 individuals who paid for the application fee, 11,387 examinees were present for the actual taking of the bar exam. This is the biggest number of examinees in the history of the bar exams. It is equivalent to 96.5% turnout, which Justice Leonen deems a good number compared to 10 to 15% attrition on the first day of the bar exams on the previous years. The Supreme Court anticipates that this will fulfill the lack of due lawyers in the last 2 years due to the pandemic. Out of the over 8,000 examinees who took the COVID-19 testing in the testing sites designated by the Supreme Court, about 1.36% of them yielded positive in COVID-19. But Justice Leonen reluctantly says they have to follow the government's guidelines and the law to avoid super spreader event. The bar examinees, however, expressed their relief in finally being able to go through the exam after several delays in the last 2 years.
Mas mahaba yung time to review, so mas mataas yung expectation, but at the same time, sa dami rin ng inaral at sa dami ng it's very hard to like filter kung ano yung talagang relevant and dapat ma-retain for the exam.
For me, 2 years actually more on agony kaysa nakatulong sa pag-aaral. Kasi syempre with the new syllabus na binigay ni Justice, nakakagulat. Pero ang bait ni Justice.
Okay naman, it was a novel experience. And siya, as in halo-halo din talaga, but kinaya naman. Finally, parang medyo nagbubunga na after almost 2 years.
Okay naman. So kaninang umaga medyo maraming tao, yung pila mahaba. Pero mabilis naman yung flow. Then napanatili yung social distancing. Safe naman mag-exam kanina.
And that's the latest on my end for tonight. Back to you, William.
Yes, thank you very much. Asher Kadapan reporting live from Quezon City. Stay with us for more when Y News returns.